So welcome and thank you everyone for joining us today. My name is Linda Tittle. I'm the Regional Director of Sales and Marketing for Ontario for Verve Senior Living, and I have the pleasure of moderating today's sessions. Virtually Verve is a series of virtual sessions on a variety of topics delivered by our dedicated team along with some of our trusted professional partners that assist Verve in being one of Canada's best managed companies and leader in senior living. Today's session is titled Stepping Towards Safety in Retirement Living. Verve Senior Living is focused on stepping towards the health and well-being of all seniors with the goal of improving their quality of life and supporting a healthy aging process. While thank goodness not all seniors will experience a fall, falls are the #1 cause of injury-related deaths, hospitalizations, and emergency department visits for seniors in Canada. Older adults who are admitted to hospitals for a fall spend on average 22 days longer in hospital above other injury-related admissions, and over 1/3 of seniors are admitted to long-term care following hospitalization for a fall. It's why we focus on prevention of falls and health decline, not just management of mind, body, and spirit. Our session today will cover Verve's proactive approach to senior health and lifestyle through comprehensive assessments, wellness checks, technology, and specialized programming, all delivered through our dedicated caring team of professionals. Allow me to introduce our esteemed panel of experts today. Ruth Langdon, Regional Director, Wellness Canada. Maybe you can just do there we go. Ruth joined Verve in 2001 as a staff nurse with a background in geriatric nursing and consistently displayed excellent organizational leadership skills, rising to the challenges of General Manager, Area Manager, and now Regional Director of Wellness for Western Canada. Ruth's people skills and clear passion for our senior industry have led her to develop wonderful relationships with our residents, their families, and team members across our organization. Also on our panel today is Denise Cato, National Director of Wellness, Verve Senior Living. Denise has worked for Verve in many different capacities over the past 25 years. Nurse, Health and Wellness Manager, General Manager, and is now been in the National Director of Wellness role since 2017. She has a passion for seniors and residents living with dementia. She's a certified dementia practitioner with the National Council of Certified Dementia Practitioners, has a geriatric certification through McMaster University, and most recently is a certified gentle persuasive approach coach. And last but not least, Dr. Alana Coleman. She's got a myriad of letters after her name: DNP, MN, NP-PHC. And I needed to ask what all of those were. So it is a Doctor of Nursing Practice, a Master of Nursing, and a Nurse Practitioner Primary Healthcare. Alana did say that I could cut her bio if it was too long, but when you read it, you'll realize that you really can't cut anything. So Alana specializes in the care of older adults. She graduated from the Master of Nursing and Nurse Practitioner program at Athabasca University and obtained her Doctor of Nursing Practice degree from Aspen University, where she's been inducted into Sigma Theta Tau International Honor Society, the National Society of Leadership and Success, and the Delta Epsilon Tau International Honor Society. She's a Miller Executive Postdoctoral Fellow at Case Western Reserve University in the Marion Shaughnessy Nurse Leadership Program. Alana currently works as an attending nurse practitioner for Optimal Retirement Care Solution as a care partner with us here at Verve Senior Living. She feels strongly about quality improvement in healthcare and professional practice development to improve health outcomes and has participated in several quality improvement initiatives at the nursing department and organizational levels. So you can see we have an incredibly talented group with us today. Our session is going to be presented from a series of questions that were previously submitted from our prospects, families, and some professional referral partners. So we're going to start with questions for Denise. Ready, Denise?
I'm ready.
Awesome. Number one, can you outline the process and the importance of assessments for residents that wish to reside in Verve communities?
So assessments for residents living in our retirement communities are of paramount importance. as these assessments provide a comprehensive understanding of each resident's physical, mental, and emotional needs. They also assist our team with the development of a personalized plan of care and assist us in determining if we can in fact manage their care. As for the assessment process, once a resident determines that they wish to reside in one of our communities, they're provided with a physician statement and a personal information form. And the physician statement is completed by their family physician, and they complete their personal information form. And once all of these details are outlined on the forms, they call into the health and wellness manager and we coordinate an assessment. Once it's completed and the scheduled assessment takes place, we meet with the resident and or family member prior to 30 days moving into our resident to ensure that we can meet the needs of the potential prospect that's moving into one of our properties.
Awesome. What can a resident expect during this assessment phase? And once the initial assessment is complete, how often are reassessments required?
So assessments are completed not more than 30 days prior to move-in, and all residents are reassessed and plans of care updated at a minimum of every 6 months, unless there's a change in their status. During the assessment phase, the resident and family would meet with the health and wellness manager for the assessment, and the health and wellness manager would complete a review of their medical history, review nutritional profiles, fall risk assessments, and medical evaluations. And this is determined in conjunction with the resident and the family member during that assessment phase.
Okay. And what is a personal plan of care and why are they important?
So a personalized plan of care is a document that outlines any care requirements, goals, and interventions that our residents require. This plan is important as our residents have unique needs, certain health conditions and preferences, and the plan of care assists our health and wellness team to deliver care that is tailored to our residents' preferences. Additionally, some of our residents have specialized care requirements, and their plan of care ensures that these needs, as an example, medication administration or assistance with activities of daily living, are properly outlined. This provides a guide to our team members on the care that is delivered, and the plan outlines potential safety hazards, and we develop preventative measures tailored to their specific requirements. The resident takes an active part in the development of the plan, approves the plan of care, and a copy of this plan is provided so everyone's on the same page.
Yeah, that's great to know that the residents have insight into that and
They
feel
do.
a part of it. That's great.
They do.
This question actually came in a couple times. If a resident experiences an emergency while living in a Verve community, how is the emergency handled and how are the team members notified?
So all Verve communities have a healthcare professional on site 24 hours a day, 7 days a week. And our communities are equipped with an emergency response system, and each resident is provided an emergency pendant. If in fact an emergency occurs, they would activate their pendant and our team members would respond to their location. Each team member is trained on how to deal with an emergency, and when they respond, they would assess the situation and determine the course of action. And we hope that it's not a call to the emergency services department. Once the emergency is managed, an incident report would be completed and communication to each of the team members for follow-up would be discussed at each shift exchange to ensure that there's follow-up of that resident and making sure that they're over a 24-hour period monitored after the emergency.
Awesome. How do you ensure that the residents at Verve Senior Living are safely monitored?
So, as I mentioned previously, at Verve Senior Living, our team members are trained in safety protocols and our residents are monitored regularly. Our independent residents are monitored during meal times, specifically at lunch and dinner, and attendance is taken to account for each resident. In the event that a resident didn't come down for a meal, the concierge team would call up to the suite, and if there wasn't an answer, a health and wellness team member would go up to check on the resident. As for our assisted living and memory care residents, they're monitored more closely as we have assigned team members in those households at all times, and our memory care households have coded access to ensure the safety of our residents. In addition to that, all of our Verve properties have cameras throughout the residence, and there is a sign in and out process and a concierge team available to all of our seniors in the event that they have any questions. And the concierge team would ensure as people are coming and going that they're signing in and out of our residences.
That's awesome. I know if I was a loved one and I had someone living with that infrastructure, I'd feel very comforted. So
Right.
that's great. Awesome. Thank you.
Great.
Thanks, Denise. And we're going to turn this over now to, I'm going to call her Dr. Alana. So Dr. Alana, what are the common risk factors for falls among seniors in a retirement residence?
So first I want to just say that falls are not a normal part of the aging process, and that there's actually over 400 risk factors that have been identified for falls in older adults. And many of these risk factors are overlapping, which means that these risk factors can impact one another and be impacted by each other. Many of these risk factors are predictable, which means that we can prevent them. So when we look at common medical conditions in older adults, Parkinson's disease and osteoarthritis, for example, can impact somebody's balance and their ability to walk. Urinary incontinence can make an older adult rush to the washroom. Diabetes can affect the nervous system, which can decrease sensation in the feet and impact balance. Dementia can impact somebody's decision-making process. And then deconditioning from inactivity, which leads to a loss of muscle mass and strength. And we can see deconditioning after somebody's had an acute illness where they haven't been up and walking, or if they've had a fall, they may develop what we call a fear of falling, where they self-restrict regular activities for fear of falling again. And in doing so, they have a loss of muscle mass and strength, which increases their risk for a future fall. Also taking high-risk medications like water pills that we call diuretics. They can lower blood pressure, making somebody feel dizzy. They can also cause an older adult to have to rush to the washroom. Or taking medications inappropriately. Maybe somebody's having difficulty remembering to take their medications, so they're not managing their underlying chronic conditions. Wearing inappropriate footwear is another common risk factor among older adults. They may be wearing shoes that don't have backs. Their heels may be high. For example, you wouldn't want to wear a heel that's higher than 1 inch. You want to wear a heel that has a good grip, a good rubber sole. Or if somebody's walking around in their stockings or bare feet, then they're not getting the right support for their foot and ankle, and so that's going to increase their risk for fall. Also, when we look at hazards within their environment, so having area rugs in the suite can be a tripping hazard, or having clutter in the walkway. If somebody has clutter in their walkways, then that can be a tripping hazard, or it may prevent their ability to use their walker. And so they'll leave their walker in an area to get through a cluttered area, which increases their risk for fall. Also having unsafe furniture like chairs with wheels, or I've seen residents who have gone to sit on their walker but have forgot to lock the brakes. So that can be a falling hazard too. When we look at some outdoor hazards, so having snow and ice during the winter, or having uneven and broken sidewalks can increase the risk for falls too. And then we do see some changes with the natural aging process that can increase fall risk in older adults. So as we get older, our reflexes aren't as quick as they were when we were younger. We process medications differently. So we have changes in our liver function and our kidney function, which means our body is slower to break down medications and then excrete them from our body. So that increases our risk for unwanted side effects. Also in retirement homes, an older adult may not have access to a personal support worker. They may not realize that they need that additional help with dressing and bathing, or they may not want to bother the staff for extra help. And so that increases their risk for fall. And then of course, access to a primary care provider. Some residents have a primary care provider that is still in the community, and getting to see their primary care provider can be challenging if they have problems with their mobility, if they have memory problems. They may be reliant on a family member to take them to an appointment. And so their underlying medical conditions may not be managed properly, which increases their risk for a fall.
Well, lots of considerations to think about. Absolutely. So what measures are in place to identify and mitigate the fall hazards then?
So fall reduction in retirement homes really is everyone's business, and every team member needs to take an approach to identifying fall risk so that we can reduce fall risk. And so you can sort of break it down by departments and team members. So nurse practitioners and physicians play an important role in screening residents for fall risk when they're admitted to the retirement home, during their initial admission, when they return from hospital. If there's a change in a resident's level of care, so if they go from independent living to assisted living or memory care, identifying fall risks. Also, the Health and Wellness Department plays an important role. So personal support workers can ensure that residents are wearing safe shoes, that call bells, the emergency pendants, are not tucked underneath clothing. So if a resident needs to reach overhead to get an item, they can call for help, or if they should fall, the emergency pendant is available to call for help. Making sure that if a resident wears corrective lenses, like their glasses, that their glasses are on, that the lenses are not smudged. If a resident has a hearing impairment and wears hearing aids, making sure that the hearing aids are worn. And if a resident isn't wearing their hearing aids, inquiring why. Maybe the battery isn't working, or maybe the hearing aids need to be cleaned. Registered practical nurses are giving out medications daily. So they play an important role in identifying high-risk medications and communicating that to a resident's primary care provider. So even though they're not prescribing medications, they're still able to identify high-risk medications and discuss that. Housekeeping, for example, when they're going into a resident's suite to clean, they can look for risk factors. So making sure that the shower has a non-slip mat, that there is not clutter in walkways. Environmental services can make sure that during the winter that there's sand, or salt that's placed on ice to prevent slipping, that any of the lighting outside the building isn't broken. And the dining room staff can ensure that residents are taking their walkers to the dining room table and that they're not leaving them at the entrance of the dining room. Also, the life enrichment team plays an important role too, ensuring that activities aren't done outside on a hot day. Residents are maintaining adequate hydration when they're participating in activity. If they're outside, that there's shaded area for residents. Residents are wearing appropriate clothing. And also if a resident has a mobility aid like a walker or a cane, that they're using that during activities too. And then also, most importantly, involving residents and their families in fall prevention. It's really important to see what a resident's perception of a fall is. Maybe they do think that it's a part of the natural aging process, and it isn't. And really involving the resident and the family in some self-management as well to reduce their risk of fall and the decision-making process.
Awesome. The next question, you may have answered this in what you just talked about, but it was, what role did team members' training play in fall prevention? And are there specific protocols for responding to fall incidences? So do you have anything to add in that regard?
Yeah, so I think with training, having training done during the orientation process is key for all team members in retirement homes, and then having continuing education throughout the year too. Because team members, they come, they go, evidence-based practice with regards to falls and management is always changing. And then having team members have a fall prevention mindset whenever they come into work, because as I said, falls are really everybody's business. And so when team members come on site, that they're looking for risk factors inside the resident suite, inside the building, and outside the building. And if they see a risk factor, bringing that to the attention of the most responsible person. Also, when we look at post-fall practices, despite our best efforts, residents will still fall. And documentation is key, especially on incident reports, because they're a critical communication tool. So we want to make sure that when we're completing an incident report, that they're very detailed. So we want to ask residents how they were feeling at the time of the fall. Were they feeling dizzy? Were they rushing to get up to go to the bathroom? Those may be key indicators for why somebody fell, or what any actions that they may have had. Were they bending over to pick an item up off the floor? If a witness is available, we can take information from the witness. Also assessing the environment. So where did the resident fall? What time of day was it? Where's there a hazard near the area? So does the resident usually use a walker, but where the resident fell, their walker wasn't present? So that can tell us a little bit about how a resident falls so that we can tailor some strategies to prevent a future fall. And then taking that information and then giving it to the most responsible team members too, so that they can intervene to reduce future falls as well.
Yeah, finding out the why to be proactive. That's perfect.
Exactly. Yeah. And residents may not be able to recall the event of their fall later. So if they're going to see their primary care provider a day or two from the event, they're not going to know. And so having that information on an incident report is critical.
Yeah, absolutely. So next question, how is medication management addressed to prevent potential side effects that could contribute to falls?
So polypharmacy, which is 4 or more medications, can actually increase fall risk by 70% from drug to drug interactions. And so when we look at older adults, we really want to look at what we call the deprescribing process. So we want to look at stopping medications that are no longer appropriate. So a resident may have come into the home that they were prescribed a medication several years ago that's no longer necessary, or maybe that medication dosage is no longer appropriate for them because their kidney function has changed. So we need to decrease the dose. Also, maybe we need to change the class of the medication to something that's a little bit more safer. And we do that with a discussion with the resident because they need to be involved in their care. We know that certain medication classes increase the risk for fall. So for example, sedatives to help somebody with sleep and narcotics for pain. But at the same time, you don't want to hold a narcotic from a resident who's having pain, because if they're going to have pain, they're not going to be mobile, which increases the risk for fall. So really having a discussion with the resident and their primary care provider. So you always want to balance the risk versus benefit. And then, you want to look at the resident's ability to take medications. Maybe they have trouble with mobility, or maybe they're having trouble with opening bottles with their hands, so they benefit from what we call a blister packaging, where their medications are organized for them. Or maybe they're having trouble remembering their medications. They need help from the nursing team to administer their medications so that they're taking them safely.
Alana, if I could just add as well, I think it's an important comment here as it relates to medications and the risks associated with more than one medication.
Mm-hmm.
From a health and wellness standpoint, it's also important to mention that the health and wellness manager is actively involved when a resident unfortunately goes to hospital. Sometimes there are medications that are prescribed while they're having their hospital stay. As an example, we know how noisy it can be in a hospitalized setting, and then they're prescribed sleeping aids. And these sleeping aids, unfortunately, when they're discharged back to us, are included on their medication list. And this is something that the health and wellness manager assesses prior to discharge from hospital. And we also work with our pharmacist to ensure that the medications that they're returning from hospital on are reviewed so that we can, in fact, demedicate people as much as possible, because it does increase their risk for falls, and also increases a risk for a lot of other things other than just falls.
Yeah.
So
absolutely.
It's important just to mention that there is a reassessment process when somebody is returning to hospital, and the importance, getting back to why assessments are important. This is a very good example of why reassessments are important, and we're not waiting for 6 months to reassess people. As people are returning to us from hospital, we also know that there's a deconditioning process. If they've been in hospital for an extensive amount of time, they're not necessarily getting the care that we would provide. And getting people out of the hospital and back to us as quickly as possible is certainly our goal at Verve Senior Living, because we know what happens, unfortunately, when people go to hospital. Yeah.
We talked about that in the introduction. It's definitely not where you want to be.
No.
Thanks for that. That was great, great additional information. Last question for you, Dr. Alana. What is the protocol for residents who have sustained a fall, and how are they monitored?
So first, we want to do an immediate assessment of the resident, and we're going to look at basic life support. So airway, breathing, circulation, their level of consciousness. We're going to do vital signs measurements, and then we're going to assess for the presence of any injuries. So head injuries, heart rates. We're going to look for neck or hip pain, which may indicate a fracture. If they have, if we're concerned about a fracture, unfortunately, they would have to go to the hospital. However, if they have a superficial injury like a cut or abrasion, we would manage at the home. And then we want to look for the cause of fall, and then we want to remove any risk factors to prevent a future fall.
Right. So again, speaking to the importance of the being proactive on that front, right?
Mm-hmm.
Great. Thank you. Thank you so much for that. And last but certainly not least, for Ruth. Ruth, how are residents assessed for a fall risk, and how often are they conducted at Verve Senior Living?
Our residents are initially assessed upon admission to our sites, as Denise alluded to in one of her questions. And then every 6 months, or whenever we see a change in status of a resident, sometimes residents communicate that they're not feeling well. So we're on guard at that point, and then we would do an assessment if needed.
Okay. And what specific exercise programs or physical activities are tailored to improve balance and strength for your residents?
Our life enrichment teams are all certified in CanFit Pro, and they provide group fitness to our residents. As qualified fitness instructor specialists, they can lead residents in various formats of cardiovascular conditioning, muscle strength and endurance training, stretching, relaxation, balance exercises, and calming exercises. We also offer bar exercises, which cater specifically to balance exercises. Yoga, Tai Chi, and Sit and Be Fit are all great ways as well to enhance the core muscles, which are great for balance.
Great. What safety features are in place in common areas and resident suites to reduce the risk of falls at Verve Senior Living?
In all of our Verve buildings, we have emergency call systems, and they're located in each individual resident's suites, in the living room areas, as well as in their bathrooms. Each resident can also wear a wrist pendant or a neck pendant to call for assistance whenever needed. In common areas, we have pendants as access as well, and in public washrooms. Chairs and seating are strategically placed for quick access when a resident is feeling fatigued and need a rest. Handrails are installed along both sides of the hallways in all of our buildings. We do not use mats or rugs that may cause residents to slip or fall, and we alleviate congestion of plants and decor in high traffic areas. If a resident were to walk outside of our building, in some cases, and had a fall, they can use their wrist pendant, and we would be notified to our nursing team, the LPN and healthcare aide, that a resident has fallen and the area to where they have fallen. And then, of course, our teams respond accordingly.
That's great. Awesome. Describe the communication strategies that are employed for residents that are a fall risk or that have had a recent fall.
So we have care conferences with our residents' families who have fallen, and we follow up with their plan of care to reduce falls, and we communicate the falls reduction plan in the care plan and with all of the other team members. Additionally, we hold multidisciplinary meetings with different departments so that we can know how a resident is doing in exercise classes, how they're doing when going in and out of the dining room, how they're performing at activities. And one of the things that residents do in lots of activities to watch is they will, like Alana said, sit on their walker without their brakes applied. So we always say this is a no-no, and we always advise residents not to do that.
Yeah.
We make sure that we share all of the information with our team members for those residents who are at fall risk.
Great. I love hearing about the sort of holistic overview from everybody. It takes a village, right?
That's right.
Awesome. Last question for you. How are residents' individual fall prevention plans incorporated into their overall care plans?
The reduction care plan is incorporated into our care plan on our Medicare care plan software. And then that's accessible by all of our health and wellness teams into their daily care plan and part of their activities of daily living. This is shared with the resident who, is resident-centric. So they take part in their care plan as well and in the action of their care plan as well. And all of our team members are aware of the care plan that is in place. Those care plans are updated every 6 months or at a change of status of a resident.
That was a most informative session. Thank you to everyone. Dr. Alana, Ruth, Denise, thank you for sharing your knowledge and your expertise with us today. I'd especially like to thank all of you that attended the session today. Time is precious, and we thank you for sharing your day with us. We don't have any time for questions today. It was a very full agenda, but we'd be more than happy to address any questions that you do have. If you would like to send any questions to me at ltittel, Tittel, at verveseniorliving.com, I can certainly get those questions to any of our experts here today and get the answers that you require. So thanks again so much for attending, and have a spectacular day.